My name is Mabel Akpotowo, Mabel Akpotowo. I'm going to be performing a cardiac and GI assessment on my patient. The patient's heart rate is 105, which is tachycardia. Blood pressure is 167/100, which is hypertension. Temperature is 37, which is normal, and respiratory rate is 20, which is normal. My patient's tachycardia may be related to pain, anxiety, or decreased cardiac work output. My patient's elevated blood pressure increases myocardial oxygen demand, which raises my concerns for acute coronary syndrome. My nursing priority is to put my patients on continuous cardiac monitoring, obtain a 12-lead ECG, and establish an IV access. Also, I'll be reporting the findings quickly to the physician. I'm going to be inspecting my patient. My patient appears uncomfortable and fatigued. My patient's skin color is within the ethnicity, with no jaundice, no pallor, no cyanosis. My patient is alert, cooperative, and responds to questions appropriately. There's no visible jugular vein dissection, venous dissection. There's no visible precardial pulsations. There's no use of accessory muscles or increased work of breathing. Now, I'm going to be performing assessing my patient's peripheral pulses. I'll be starting with the carotid artery, one at a time. I'm going to be doing the brachial bilaterally, the radial bilaterally, and the dorsal pedalis bilaterally. I'm going to perform hand hygiene. My patient's pulses are regular, equal bilateral, and 2+ strength. I'm going to be assessing for capillary refill. Capillary refill is less than 3 seconds with your legs. Capillary refill is less than 3 seconds. I'll be performing hand hygiene. I'm going to be auscultating my patient's heart sound. I'll be landmarking. Aortic within the second intercostal space within the right sternal border, pulmonic within the second intercostal space of the left sternal border, EBS within the third intercostal space of the left sternal border, tricuspid within the fourth to fifth intercostal space of the left lower sternal border, and mitral apical area within the mid clavicular line in the fifth intercostal space. I'm going to be auscultating with my diaphragm. Aortic, pulmonic, EBS, tricuspid, and mitral. I listen for S1 and S2 sounds, and S1 and S2 sounds were heard. The S1 sounds were heard the loudest at the mitral apical area, and the S2 sounds were heard the loudest at the aortic pulmonic area. I'll be using my bell to auscultate for S3, S4 sound, and murmurs, which is whooshes, squishes sound. Aortic, pulmonic, EBS, tricuspid, and mitral. No S3, S4 sounds heard, no murmurs heard. I'm going to be listening to the heart sounds for the apical pulse for 1 full minute. The apical sound is regular, apical pulse is regular, and is 105 according to the recorded patient's heart rate. Now, I'm going to be doing the abdominal assessment. Lay down, please. I'm going to be inspecting my patient's abdomen is symmetrical. The umbilicus is midline. The skin is intact with no stria, no rashes, no bruises, no lesions. There's no the abdomen it's flat with no obvious no visible distension or masses. I'm going to be auscultating the abdomen, starting from the right lower quadrant. The organ here is the appendix. Right upper quadrant, the organ here is the liver. Right lower left lower quadrant, the organ here is the spleen and stomach. Left lower quadrant, the organ there is the semicolon. I hear active bowel sounds, and it occurred 5 to 30 times per minute. Now I'm going to be percussing on starting from the away from the pain, while looking at my patient's facial expression for any discomfort. I'm going to be percussing 3 times in each quadrant. 1 2 3 1 2 3 1 2 3 1 2 3 1 2 3 1 2 3 1 2 3 1 2 3 1 2 3. I hear Tiffany over the intestines because of the air, and I hear dullness over the solid organs because of solid livers and solid organs like the liver. I'm going to be palpating with the parts of my hand in a circular motion softly. Started from the right lower quadrant anti-clockwise down to the left lower quadrant away from the pain. There was no rigidity, no guarding, no masses, no abdominal organ enlargement. I'm palpating the epigastric region where my patient has the pain. There's light tenderness due to the pain. What do I think it's happening? Due to the chest pain that is radiating to the left side to the left shoulder, the epigastric pain, the nausea, vomiting, the hyperlipidemia, diabetes, and family history of coronary of MI. I think my patient is experiencing acute coronary syndrome, such as myocardial infarction. My nursing priority is to place my patient on continuous cardiac monitoring and obtain a 12-lead ECG. Second priority will be to establish an IV access, and so I can give any prescribed nitroglycerin or aspirin as ordered, while reassessing for pain and the vital signs. Also, two physician orders I'll be expecting is the 12-lead ECG and cardiac blood work, including troponin and CKMB. Thank you.